welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman and here is what I bring to you all from the world of medicine. The effects of mental health in congenital heart disease patients. More mental health support that is integrated into the routine health care is advised to help them achieve optimal health and quality of life, according to a new American Heart Association scientific statement published in Circulation, Cardiovascular Quality and Outcomes Journal. An American Heart Association scientific statement is an expert analysis of current research and may inform future guidelines. The association's 2011 scientific statement on a related topic addressed developmental delays and other neurodevelopmental outcomes in children with CHD. However, this is the first statement to summarize the psychological and social challenges from childhood through adulthood and to review age-appropriate mental health interventions to improve quality of life. According to the new statement, children with more complex congenital heart defects have a 5 times higher rate of receiving an anxiety diagnosis in their lifetime compared to children without congenital heart defects. Despite the evidence of emotional, social, and behavioral difficulties, only a small fraction of children with congenital heart defects are offered or participate in mental health assessment or treatment. For adults with congenital heart defects, the rate of experiencing a mood or anxiety disorder in their lifetime is about 50% compared to about 30% for adults in the general population. According to the statement, approaches to mental health care may encompass self-care strategies such as relaxation techniques and hospital-based or online support groups, psychotherapy such as talk therapies for individuals, couples, families or groups, and medication therapy where a medical team can determine appropriate heart-safe medications for depression or anxiety. The statement strongly advocates for the integration of mental health professionals within CHD specialty care teams. Integrated mental health care normalizes emotional reactions to health challenges, reduces stigma, improves timely access as soon as health challenges arise, and provides coordinated care across the multidisciplinary healthcare team. Researchers said that the goal of this statement was to foster psychologically informed care that empowers people with congenital heart defects and their families and provides emotional support. They would like mental health assessment and support to be part of comprehensive care for all people with congenital heart defects rather than a special service that is offered only in some places or special circumstances. How stem cell and artificial intelligence can be put together for predicting cardiac arrhythmias. Onset and severity of arrhythmic events in patients are notoriously unpredictable, particularly in younger patients with no history of cardiac disease. Researchers combine stem cell technology with machine learning, which enable them to predict with a high degree of accuracy arrhythmias in the lab. The results of the research were recently published in the journal Stem Cell Reports. In their research, the team used human heart muscle cells, so-called cardiomyocytes, which were made from pluripotent stem cells in the lab. The different cardiomyocyte cultures used in this study had varying propensities to arrhythmias due to genetic mutations or drug treatment. Using video data from more than 3,000 healthy and arrhythmia-prone cardiomyocytes, the researchers trained a machine learning program on the specific beating behavior of the cultures using a visible indicator of changes in calcium concentrations within the cells as a measure of heart function. Using this system, the computer algorithms achieved over 90% accuracy in predicting the occurrence of drug or genetically induced arrhythmias and identified distinct patterns predictive of arrhythmias. This research lays the foundation for machine learning-based patient risk profiling and drug toxicity testing in patient-derived cardiomyocytes, which could help to generate safer and more effective medicines, the researchers concluded. Common myth that leaner people are more active and have less health problems. To date, most research on obesity has focused on studying those with a high body mass index (BMI), but a research group in China is taking a different approach. In a study published July 14th in the journal Cell Metabolism, the scientists looked at individuals with a very low BMI. Their findings reveal that these individuals are actually considerably less active than people with a BMI in the normal range, contrary to speculation that they have a metabolism that makes them naturally more active. Additionally, they eat less food than those with a normal BMI. The investigators recruited 173 people with normal BMI, that is range 21.5 to 25, and 150 who they classified as healthy underweight with a BMI below 18.5. They established questionnaires to screen out people with eating disorders as well as those who said they intentionally restrained their eating and those who were infected with HIV. They also excluded individuals who had lost weight in the past 6 months, potentially related to illness or were on any kind of medication. Participants were monitored for 2 weeks. Their food intake was measured with an isotope-based technique called the doubly labeled water method, which assesses energy expenditure based on the difference between the turnover rates of hydrogen and oxygen in body water as a function of carbon dioxide production. Their physical activity was measured using an accelerometry-based motion detector. The investigators found that compared to a normal control group that had normal BMIs, the healthy underweight individuals consumed 12% less food. They were also considerably less active by 23%. At the same time, these individuals had higher resting metabolic rates, including an elevated resting energy expenditure and elevated thyroid activity. Researchers concluded that though these very lean people had low levels of activity, their markers of heart health, including cholesterol and blood pressure, were very good. This suggests that low body fat may trump physical activity when it comes to downstream consequences. The step therapy and its effectiveness in treating diabetic eye disease. Clinical trial results from the DRCR Retina Network suggest that a specific step therapy in which patients with diabetic macular edema start with a less expensive medicine and switch to a more expensive medicine if vision does not improve sufficiently gives results similar to starting off with a high-priced drug. The main complication of diabetic macular edema, fluid buildup in the retina that causes vision loss, is commonly treated with anti-vascular endothelial growth factor drugs. Results of the trial, which examined a stepped regimen of an anti-VEFG drug, that is vascular endothelial growth factor, Avastin and Eylea, were published today in the New England Journal of Medicine. The study enrolled 270 participants with diabetic macular edema, some of whom received treatments in both eyes. At enrollment, all had best corrected visual activity between 20/50 and 20/320. Half of the study eyes were assigned to Eylea from the start and half were assigned to the start with Avastin. For participants who needed treatment in both eyes, each eye started treatment with a different drug. Participants received either Avastin or Eylea injections every 4 weeks for 24 weeks. If eyes assigned Avastin failed to reach the preset improvement benchmarks starting at 12 weeks, the eye was switched to Eylea. After 24 weeks, physicians could taper down the frequency of injections as appropriate to maintain visual acuity. The study collected information about participants' retinal structure and visual acuity for 2 years. After 2 years, eyes in both groups had similar visual acuity outcomes, improving on average approximately 3 lines on an eye chart compared to the trial start. In the Avastin eye group, 70% of eyes switched to Eylea during the study. Researchers concluded though most participants on Avastin eventually switched to Eylea, they still had improvement during those initial weeks, even if they didn't hit their preset benchmarks. There are large cost disparities between these drugs, so differences in treatment strategies may have substantial cost implications. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.